So, typically at this age, most kids over 5 or 6 should be able to wipe themselves. So, I think we probably have a little bit of behavior issue going on here too. But first off, the constipation. What I think is happening is the bottom of his rectum, where all the stool is kind of stored, if kids are holding it too much, it tends to get stretched out, and then they kind of lose the ability to sense it's full, and they kind of typically just leak all day long, and that can be a big problem. And I imagine when he is going, he's having a pretty hard stool, but he doesn't get all of it out because the rectum has lost its elasticity, so there's still some hanging on in there. So he goes to wipe it, he gets, and he just starts making a mess because there's still more stool coming out. And so I think what we need to do is make sure he's getting nice, loose stools. And we need to get him nice and loose for several months, all right? And we're gonna do it with his diet, lots of fruits and vegetables, fish. The Miralax that he's on, a lot of kids use it. It's not a very natural substance. It's polyethylene glycol, which, there's not supposed to be that many side effects to it, but I'd rather not kids do something very unnatural all the time like that. So what I might suggest is using something like a fish oil supplement or a flaxseed oil supplement. It's actually good for him. He'll absorb some of the oil, but then some of it will kind of keep going down and act as a stool softener and a lubricant. So maybe every day a good 500 milligram tablet or liquid. They make ones that taste good for kids, so he'll like it. He can just drink it down in a teaspoon. That'll probably help a lot. Now, in terms of getting him to wipe, I think one suggestion, instead of using toilet paper, because that can be sticky and messy, maybe use wet wipes, flushable wet wipes. They're a little stronger, and he can just it'll slide a lot easier down there, and chances are he'll make much less of a mess using something like this. So also, once we get his stool softened and nice and loose, we want to keep it loose for months, like 3 or 4 months. That's going to give his rectum a chance to shrink back down into its normal size, and then he'll kind of regain the tone and the ability to tell if it's full or not full. So how are you going to do that? We need to get it so he never holds it. So the best time to have a bowel movement is right after a meal, because there's a reflex. When your stomach fills, everything else tries to move through. So right after breakfast, right after lunch, right after dinner, he needs to get into the habit of going to sit down. Even if he says, I don't need to go, just go sit down on the toilet. Sometimes that just kind of triggers it. So you're going to need to talk to his teachers at school and try to maybe encourage maybe a little separate time he can kind of just disappear right after lunch and get that to happen. So hopefully relaxing about all this. I'm sure he's kind of secretly worried about it. And even if he acts like he doesn't care, if he smells like poop all the time, believe me, he cares.
Yeah.
And Tiffany, I was going to ask really quickly, do you guys have primarily white bread in the house or whole wheat bread?
Whole wheat bread.
That's good.
And that's great because I see a lot of
Oh, yeah.
into the teenage years, kids get so constipated because there's only white bread versus the whole wheat bread. So that's great because he's getting some added fiber.
Yeah, we need all that fiber. Make sure he needs about 17 to 20 grams of fiber per day. And so make sure, just kind of keep track of his diet for a couple of days and just kind of calculate how much fiber he's getting. Make sure it's 17 to 20 grams.
Thank you so much, Tiffany. We wish you the best of luck.